My name is Dr. Steve Henao, and we're broadcasting from Albuquerque, New Mexico's Heart Hospital. Today we'll be presenting the first ALTO case in the western United States for a treatment of a 6-centimeter aneurysm of a 79-year-old gentleman who we've evaluated with CT angiography. We have a number of choices when it comes to the treatment of abdominal aortic aneurysms. At our facility, we have chosen the ALTO as the new workhorse platform for aortic aneurysms because of the low profile and the short neck indication, as well as the robust data set that shows excellent long-term results over 5 years with the polymer sealing ring technology that was adopted from Ovation. There is so much to be gained for the ability to lower the profile of a device and to be able to minimize the requirements for the length of an infrarenal neck, and that is going to be applicable to every abdominal aortic aneurysm case that we see worldwide. So in my opinion, I think you want to be using a device that you're going to be using every day and not niche it or use it as a special occasion device. This is the perfect, again, workhorse platform for EVAR. I think one of the main drivers for complications in the EVAR space is when the operator wanders off the IFU or the indications for use. That's something that we've seen over and over again in the literature as being a huge component that leads to migration, type 1 endoleaks, repressurization of the sac, and eventual rupture. As amazing as the engineering is behind this device, the final step in the manufacturing of a EVAR case is, in this case, the custom seal. In other words, the polymer is customizing the seal around every nook and cranny of the infrarenal neck so that it's a perfect seal, as opposed to an approximate seal that happens in every other endovascular aneurysm device. The ALTO device is, without question, the biggest leap in technology for the EVAR space. It truly serves as the new workhorse platform that will provide a more broadly applicable technology to more patients around the world. The ALTO system is based off of the very successful Ovation polymer seal technology, and we have 5-year data from the Encore set, which has been previously prevented, that demonstrates remarkable improvements in morbidity, mortality, and secondary interventions. Borrowing from that, but improving on it with reducing the requirement of the neck length, as well as the potential use for the integrated balloon, makes it for a very exciting platform for future use. The ALTO device is the most compelling device on the market today. The most compelling component of this is the short nick indication of 7 millimeters, which I believe is going to totally change the face of our options for EVAR today. If I was going to provide one tip for the use of the ALTO, it would be to recognize that it is a very precision-based device, and it requires an exact placement of the sealing ring to get optimal results. And you need to be in close communication with your Endologics representative to get the best results.